I am Corie Thayer. I'm so glad that you guys have joined us tonight, and thank you for joining us. If you don't know who I am by chance, that's okay. I cover the Midwest for admissions here at UMHS. I work with a few states in the Northeast as well. So we are glad you're here. This webinar, way more importantly, I am accompanied by three fantastic of grads of ours who are going to just kind of go over all the raw, real, and hard questions that I know I in admissions get all the time. So we're going to kind of dig up some of those questions and yeah, hopefully it'll be good. And again, I'm so sorry everyone for the tech difficulties. But Dr. Rustom, may I throw it back over to you to introduce yourself? Oops, Dr. Rustom, you're on mute. I'm sorry.
Hello, good evening.
Hi, you're
My
there.
name is Dr. Rustom, and I went to UMHS in 2008. I began my journey there. Uh, I had initially wanted to go to medical school in the United States, but a buddy of mine decided to go abroad to the Caribbean. And we went together. We were roommates for the first 3 semesters. And we were able to complete it successfully as the first graduating class in 2012. During that time, I was able to land a residency in physical medicine and rehabilitation at Wayne State University, and later completed a pain management fellowship at the same hospital system. And I have been working there as an associate program director and pain management fellowship, a part of the physical medicine and rehabilitation faculty, and I'm involved with research and I work with medical students, residents, and fellows alike. And I've been there for 10 years.
That's awesome. And you went to Wayne State as well for undergrad, yes?
I grew up in the Metro Detroit area, and I attended Wayne State and Henry Ford College. At the time, it was community college.
Nice.
And I took a backdoor route to medical school, and I'm thankful for the support through UMHS.
For sure. Well, thank you, Dr. Rustom, and thank you so much for being here. Thank you.
Absolutely.
I appreciate it. Dr. Khobeir, I'm going to throw it over to you to introduce yourself.
Hi, guys. I'm Alexander. I'm a third-year emergency medicine resident at McLaren Oakland here in Pontiac, Michigan. I grew up in a small little area called LaSalle in Monroe County on the border between Ohio and Michigan. I actually went to high school in Toledo, Ohio. I attended undergrad at University of Michigan Flint, where I completed 2 bachelor's degree and then went on to start and finish my master's. I initially started it in an effort to apply to U.S. med schools and ultimately didn't happen on my first cycle, and then went to complete it. My story is I'm a transfer to UMHS. So I started at Ross University in the Caribbean. Then a Category 5 hurricane caused everything to go haywire. And then I came to UMHS afterwards.
Sounds good. Sounds good. Thank you, Dr. Khobeir, and thank you for being here as well. Thank you so much. Dr. Thibault, I throw it over to you. I'm glad you're here.
Hi, everybody. My name's Adrianna Thibault. I am a board certified family physician. I'm almost certified in menopause medicine. Give me a couple months. I'm actually a faculty member at Oakland University William Beaumont School of Medicine as well. And I'm private practice in Metro Detroit. I went to UMHS graduating in 2019. And so then I did my residency in rural family medicine at Munson Medical Center up in northern Michigan. That's in Traverse City. And just moved back down to Metro Detroit to practice. Went to Albion College, which is a little more like about half hour to 40 minutes past Ann Arbor, if you know where that is in Michigan. And it was actually a fellow Albion classmate and friend who I worked with after I graduated undergrad, who kind of put UMHS on my radar. So we both ended up going there, and she's now actually, we live 2 streets away from each other, and she's now a practicing physician as well. So
Amazing.
yeah.
I love that. And honestly, Dr. Thibault, that's a perfect kind of segue. You know, you spoke about yeah, just UMHS and, you know, having a friend with you, which is great. Someone from Albion. I love that. I'm just curious, did you have any reservations about attending a Caribbean school?
No. So I'll put it this way, and it's probably an unusual answer. I didn't feel nervous or scared to go to the Caribbean for medical school. I think I was nervous in general for school, and it wasn't my initial path. So this was, you know, a second chance, I would say, at doing what my dream ultimately was. For whatever reason, I have various family members live on different Caribbean islands for all different reasons. And one of those family members was actually my father. So he graduated from a Caribbean medical school almost 40 years ago. He'd hate for you to know how old he really is. But so I had that example. I knew it was a viable option. I knew you could do it. That was never a question in my mind. I was lucky to have that example, and through him, a lot of connections of very successful physicians in the area who had gone the Caribbean route. So all different schools. And I took a leap of faith and said, I'm going to go to UMHS and kind of do my own path.
Definitely. Yeah. And look at you now, right? Love it.
Yeah, it's worked out very well. It has worked
Right.
out very, very well. Yep.
Absolutely. Great.
Yeah.
Dr. Khobeir, what about you? Did you have any reservations about Caribbean school?
100%. It's the whole reason that I even started another degree.
Yeah.
I did not want to go to a Caribbean school, and it was not, I guess I never had anybody around me. I'm a first generation person. My parents both came from Iraq, immigrated there. So I didn't know anybody who had gone to medical school in the US alone. And when I was in undergrad, everyone said, no, don't go to the Caribbean. And that couldn't be further from the truth. 1 in 3 doctors are from the Caribbean or international medical grads in general. And thankfully, my stubbornness didn't get the best of me. So I ultimately did go to the Caribbean school. I applied to only 2, and that's because I didn't know anything else. I didn't know about UMHS. I didn't do any research. My friends were at one of 2, St. George and Ross. And so I applied and went to Ross. And that was that. Everything that came after Category 5 hurricane, I'm thankful now, but I'll tell you what, crazy experience. So
For sure. And you transferred to UMHS, Dr. Khobeir, at what point of your basic sciences journey?
yeah, so generally a medical school is divided into 2 different we'll call them categories. The first 2 years are book work, then the last 2 years are clinical work. It doesn't really matter how long it takes. It could take like 5 years, or it could take 6. In the first 2 years, I was in my last semester of my second year, and that's when the hurricane hit. And then I went over to, well, I came to the United States, then I went on a boat to the Caribbean, St. Kitts actually, which was a different island that I was on. And then when I came back to the United States after I finished the 4th semester there, then I transferred to UMHS. So
For
right
sure.
between, right before I started clinicals.
Okay, for sure, for sure. That's great. That's awesome. Dr. Rustom, what about you? Did you have any reservations about Caribbean medical schools?
I did, and for me, UMHS had just opened up, and so of course, as a first class to attend, there was many doubts and questions that were spiraling through our minds, and so that aside from the third world country and moving down and living on our own it was my first time. Back then, Skype was the big thing, and so they recently went out of business. And I was talking to my wife 2 months ago, and I said, "Wow, look at that! I mean, that was our communication." And so UMHS had established relationships with many of the local people, and so it made it easy to transition, I think, in such a challenging scenario as an early 20-year-old attending medical school in a foreign country. And so it helped to get to know people and the staff and even the janitors to the faculty all treated us with respect and helped us out with anything that we needed. So it was really easy to feel comfortable in my second semester, especially after going through first semester with that much support. The other big thing that occurred during my transition was the housing crisis in 2008, which was a drastic hit to many of us at the time. And so a lot of our colleagues and students were forced to take an MBA course through an online university to get extra funds to help cover the costs of the tuition. And for us on the island, we didn't really know about the crisis. Didn't phase us much. We were so far away from mainland, and we were so focused on studying. And fortunately, we were able to make ends meet through various routes. At that time, I had already been funded for 2 semesters, and so it gave us some extra time to find alternative ways. Thankfully, I didn't have to do the MBA program, because I can't imagine what that was like. But UMHS was really supportive. I remember at that time not discrediting many of the people who had already made drastic life choices to attend. So we also, like Dr. Khobeir, had a hurricane and stuff like that, and we felt safe and made a lot of good memories on the island. Now that we look back, I've yet to return, and I can't wait to see how the new facility is on the island there. I mean, Mr. Ross, who's the owner of the university, is really treated very well, and so are the students on this island. And there are many other schools also that even the Ross family had associations with that are also on the island that are no longer part of. But the island is full of students, American students. And so there's areas where you can enjoy your evenings, after a block or a test. And, you don't want to use all that time at the beach. Otherwise you may not do so well. But certainly you could very well enjoy yourself, go for a run. I used to do that after school. I stayed really close to the school so that I afford an opportunity to save time. And I mean, we drove on the left side of the road, for God's sake, and that was a different experience altogether. But it's
For sure.
possible, certainly, definitely. If
Dr.
you're here
Rustom,
today, then I think there's a lot to say there.
when you came back to the States, to the mainland, did you drive on the left side of the road as well? Because I definitely did it a couple times.
Oh my goodness,
Absolutely.
yeah. Well, at that time we had those roundabouts,
Yeah.
and those were just being introduced. And I think St. Kitts was the first to have a roundabout, to be honest. I
Okay.
think we were behind schedule on that.
I agree.
You remember that roundabout down there?
I'm a
Uh,
pro at them now.
I forgot what that area was, but it was just as you went to the beach there.
The one over by Basseterre, like right where you
Yeah,
get by
yeah, the
Half
big
Moon Bay.
roundabout on the way. Yeah, the
Uh-huh.
first one ever. They beat us.
These are very fond memories of St. Kitts. It's fun to hear. I love it. It's so great. Let me ask you guys this. Did y'all feel safe? Dr. Thibault, maybe I'll start with you. Did you feel safe when you first touched down on the island?
I did.
Yeah. Yeah.
Now when I went down for my very first, we're moving down there. My now husband was not my fiance quite yet. He didn't go with me, but my parents went with me. That was interesting in and of itself. I probably could have left them at home and it would have been less stressful. But story for another day. The island itself felt very safe. From the moment you step foot on the island, the people they're kind. They want to make sure you're okay and that you have what you need. So when we got there, we were met by people from the school, number one. So you don't just land at the airport and it's a free for all. There's somebody that came to the airport to greet us and make sure we knew where we were going if we needed anything. But more so, I'll talk about the longer term stuff. We had, and I don't know if he's still there. Is Snake still there? But yeah, that man, I swear, he's like a legend. So Snake was a gentleman who is like Mr. Ross's right hand man, and if you ever had an issue, I mean, we all had a cell phone number. It didn't matter if it was 3 a.m. and something happened in your plumbing or your whatever it was. That man was there in a heartbeat.
Yeah.
So that helps, when you have the cell phone number of somebody who's like your guy.
Right.
It's pretty amazing. And then, President Ross always gave us his cell phone number and his email address, and he was available. Even if he wasn't on the island, if you had an issue, you were calling him and he got it taken care of. So I never felt like I had any problem. I mean, even our bus drivers, we called them uncle, and they viewed themselves as extensions of your family. They expected you to treat them as if they were your uncle, your auntie, somebody who was always going to be there to look out for you. So that made it really, really easy to just feel at ease, to feel like, okay, this is my second home right now. I'm good. I'm in good hands. So
For sure. That is a good feeling. It's such a good feeling, especially, yes, when you have kind of all this stress that is like medical school basic sciences, that course load, to have, to not worry about all these extra external things is great for sure. So that's good. I love to hear that. Yeah, Dr. Khobeir, what about you? Did you feel safe on the island?
Absolutely. From the time I started again at Ross, which was Dominica, a completely different island, but the people there in all islands, because now been to Dominican Republic, St. Kitts and Nevis, Martinique, which are all these surrounding islands that if you're traveling, you'll see the local people want you there. They want you to succeed. They enjoy you. They enjoy your presence, your company. You're bringing something to them because you're able to, it's a business as well. So they're able to give you what you need and you're giving them what they need. And at the same time, you're building relationship. That includes the barber who has your cell phone number. He'll give you yours. Taxis, bus, whatever you need, people there always communicate with phones. and there's nothing dangerous at all. It doesn't matter what time of day, what time of night, somebody will be there to help. And I think that was incredibly important. On top of that, everything is gated. There's a lot of gates everywhere. The security that's there, they get to know you by face. You're not just somebody walking by.
Right.
They know you, and you tell them hi and you call them by their name. So I think that's incredibly important.
So important. No, absolutely. That's great. And that's really good feedback too, Dr. Khobeir. Thank you. So Dr. Rustom, I have a question for you. You are very busy, faculty at Wayne State, full-time physician, you have a family, you're a dad, you have a lot going on. How do you kind of manage your time, and how do you like self-care and balance everything? Were some of the things that you did in medical school, did that kind of carry over, some of those time management practices carry over into your life now as a professional?
Yeah, thank you so much. Yes, that's a great question. And to get through medical school, you really have to know timelines and how to prepare to get things completed most efficiently. And it's not easy. And it can be very overwhelming. And physician burnout is something that's very real. And when you're in practice for many years, you start to see different people and understand that you can help everybody as much as you can, but you also need to help yourself so that you can help others. And my biggest thing I think that's helped me was just reflecting, exercising, eating healthily, healthy eating, reading, enjoying hobbies. These are all things that are very important. And you may think that you don't have time, but there's time for everything. In fact, recently I advocate that everything can be completed in 20 minutes. And so, I think when you set your mind to something, you should be able to fit it somewhere, and you'll be surprised how much it pays back to you. Even as an attending, I went through various stages where I wanted to invest and do other things, and I even reconsidered going back to school. This is in my second or third year as a practicing of attending. I thought software engineer was really cool, and and then I decided to invest in myself even more, and so that's only helped me more with being able to have the stamina, because that's what you really need is stamina. And in order to have stamina, you have to give back to yourself. You're not going to be able to do everything. You have to sleep. You have to have good people around you. You should kind of separate yourself from social media. Maybe I think is a big thing nowadays. I can't imagine what it's like. I mean, I don't know if you caught me earlier, but Skype was a big thing for me back in the day in 2008. So there's a lot of things I believe that can affect a person psychologically, and if we don't take heed to that and adapt and continue to give back to ourselves, it's more challenging to complete anything.
Absolutely. And you make such a good point, Dr. Rustom, when you speak about, stamina. And I would say like being resilient too. I mean, these are markers of just successful people, not necessarily becoming a successful physician, but just being successful in life. And I'm just glad that you brought that up, because I think it's important to share just from an admissions perspective. Those are things that we're looking for when we're interviewing students. Excellent time management, hardworking, genuine, humble, honest, resilient. They have the stamina, right? They know what they're getting themselves into. So you bring up some really good points there. And then I love, that yes, it develops and it kind of stays with you. That's great. Definitely. We have a really interesting question. I love this question. And I know I think we are dog people on this call. I know I definitely am, but we have a question. Are we allowed to bring small dogs to St. Kitts? And that's an excellent question. Dogs are definitely allowed in St. Kitts. However, there's some things definitely to be cognizant of. There are some breed restrictions. Those are posted on the St. Kitts government website, which will pop right up if you do Google government of St. Kitts. The website will pop up and there's breed restrictions there. And I think it's important to share. Dr. Thibault, maybe you can kind of jump in on this, but you're in classes for a long period of time too. So that is truly something to just think about and consider if you are thinking about bringing your pet. And then certainly you have the whole piece of flying with your pet and all of that. So there's certainly different kind of considerations. Go ahead. I'm sorry.
So yeah, I did not bring a dog. Okay. My parents kept them and they were very spoiled, which is fair. That's where they wanted to be. But we have Ross Veterinary School, which is right next door to our medical school. And what I did see, to my fellow classmates who did bring their small dog, yes, we do have crazy hours. I mean, that's just what it is. And what they did was they actually got some of the vet students who lived either in the neighborhood or in their apartment complex. They often don't leave the island for breaks. And so there are limited abilities for them to make extra money. So if you have the ability to, you can always ask the vet students to, check in on your pet if you have them, during the day, if you're going to be studying long hours at campus. And they'll walk them, and you can always do that. They're great for that. One thing I would consider is if you don't already have a pet, but you want one, because let's be real, this kitten, he's pretty great. He's pretty good stress relief. There are a lot of animals on the island. So actually my now husband and I, we had adopted a cat that showed up in our yard. Not this one, although this one also showed up in our yard here. But we fed him, and his name was Ruggles, and he stayed with us our whole stay. We got him spayed through the vet school, and they ended up keeping him. One of the vet students ended up just keeping him, and he's somewhere in the US now living his best life too. So there's a lot of opportunities for that. Also keep in mind, if you are bringing a pet, and this is just good pet ownership, there's no rabies on the island at all. So the biggest thing that they worry about as far as immunizations go is going to be rabies. So making sure that if your pet's not immunized already, getting them up to date and making sure that you have all that paperwork from your vet in time. Because we considered bringing our other cat down at one point, but my husband flew back a lot, and so it was fine.
Yeah, for sure. Well, thank you. That was great insight and a great question. We are a bunch of animal lovers, so I love the question. So good. Dr. Khobeir, I want to throw it over to you. Do you want to chit chat a little bit about, the support that you got at UMHS for USMLE Step 1 and Step 2 CK?
Yeah.
Maybe talk a little bit about what the Portland Maine semester is like from that kind of supportive perspective.
Yeah, so it's different now, but I know when I was there, once I finished my fourth semester and transferred, there is what we call a preclinical, we'll call semester. Basically, what it does is it allows you to expand on your clinical knowledge where there are patients that are acting, let's say. And what they do is they put you in a scenario and they want to test your knowledge about what you're going to do. At the end of that, then UMHS pays for a Kaplan course that is specifically geared towards studying for USMLE Step 1. Again, all of this would be pointless if there isn't anything set to help you with boards, right? Because at the end of the day, this is what we're doing. What we're doing is we're becoming doctors to be board certified. And so UMHS takes that really seriously. They bring in, this isn't online. They bring in people from Kaplan to come and teach you day in and day out. They give you the resources, questions, lectures, and you're doing all of these things. You even get one-on-one time with the tutors if you need. This ultimately allows you to take the Kaplan exam, which then you can take step one. And it's been great because you get the best resources possible. The question for UMHS isn't, do we have this resource? It's, which resource are you going to use? And UMHS goes above and beyond, finding every resource there is possible and saying, here you go, choose one or choose two, because having too many resources is also not good. So
For sure. No, that's so great. I love it. Definitely. We have a couple of questions to you guys, so I want to kind of throw these out there. Dr. Thibault, do you want to take this one? Housing. Do you want to chit chat a little bit about our housing database and what housing looks like as a student in St. Kitts?
Yeah, so you have several options. It kind of seems endless. So the school itself has apartments very close and houses like right there in its neighborhood where people rent. That's very easy and close, and there's like a nice pedestrian walk bridge between the neighborhoods, so you don't have to go by the road, and makes it easy, especially if you're at like the library at night. Then there are other options that are like in what we call Basseterre, and then there's past that is Frigate Bay. So those are like two towns. Basseterre is the capital, and I wouldn't say many people live in the capital, but there's a lot of stuff to do, right? Like you go and hang out. If you're living more in Frigate Bay, there's houses, apartments, condos, and then there's even further over by the Marriott, they have like hotel style, longer term living quarters. And so that's basically like an apartment. So like your extended stay hotels here on the mainland, the Marriott has that as well.
Right.
Then across the street from there, there's also another what used to be like a hotel, but now is all basically, I think it's all student housing for the most part, whether it's UMHS or the veterinary students, and you're often intermixed. Your neighbors who are from the other schools become your friends, which is kind of nice. I personally did two different things. Like I said, when I started originally, I was with a friend of mine from undergrad. She had started just before I did. She had rented a house in Frigate Bay with one of our other friends from undergrad who was actually attending the vet school. Really worked out well. She was leaving and I was coming in, so I took her spot in the house. And then my now husband moved in with us. When my roommate finished and she went on, my husband and I moved to the Marriott just because we didn't really need this whole big place and really didn't want another roommate because we were getting married during one of my semesters. So that worked out really, really well, and worked out well for my husband. He got to meet so many more people that way, and yeah, I think he actually had more friends and more people he knew than I did. So it worked out well.
For sure.
Yeah.
That's great. Thank you. Someone else is asking, this is another great housing question, like the average cost of housing may be closer to campus, maybe in the Camps neighborhood or even across the street. I would say it really varies, and I know that's kind of vague. I don't necessarily mean it to be, but it really also depends, like, do you have a roommate, that type of situation, or are you living, like in a like studio kind of apartment condo by yourself. It really just depends, but I would say 900 is a safe kind of estimate if you want like an average cost. But please know, to the wonderful student asking that question, it's a great question, and money is very important. Finances are extremely important. But it really ranges. Like we have housing in our database that starts 650, it goes up to 2,300, and it all depends, and the amenities are different, and some of the things are included, and then maybe for one house you've got to go put the internet in your name, so things are just a little bit different. But in our housing database, everything is very clearly explained, and we have two fantastic ladies that are a part of our admin team in St. Kitts that take really good care of the housing database. Quite frankly, that's their jobs, to do this and run the database and keep it super top notch, and obviously check on the properties in person as they come available too. So we do take really good care of our housing. And then to Dr. Khobeir's point, he was discussing Portland, Maine. There's also housing opportunities in Portland, Maine as well. Okay. We do a lot for you guys. We really try to become the middleman of all of your, kind of your business affairs to make it easier for you so you can focus on your academics for sure. Dr. Rustom, I'm going to throw this one to you, although I know it's been a while. Do you remember about the exams and how they were graded? Am I putting you on the spot?
Yes. So we took exams, in every 4 to 6 weeks, if I recall, and they were blocks.
Mm-hmm.
And at the time, they were graded like your regular exams are graded, I believe. There was a percentage that I received that was comparable to how many I got right versus wrong on the exam. And they would post these results to your unique number outside beneath maybe some palm trees. And at 1 o'clock, you would run over there and check to see whether you passed or failed. And so, I think it was more or less. I think what I liked or enjoyed about the faculty at UMHS was it wasn't so much of my grade as much as how I was being reared into a physician. And so you develop a repertoire with your attending. And the class sizes at the time were small. Some were large, but there were always after hours and opportunities to tutor and receive extra education. And I at times me and my friends and I we had medical student syndrome. So we'd be reading about some type of process, and before you know it, we'd develop the symptoms. And my friend and I, we were seen by emergency specialists for these panic-related disorders. And I remember the doctor at the time, Dr. Fogel, who was my favorite professor of all time, who was at UMHS, who is now deceased, reassured me on several occasions that I was just having anxiety or panic. And so, as you can see, you knew your attendings very well. And with the assessment in the 5th semester, you knew where you stood before you would take the board examination. And so it's up to you to really, decide on, do I need to study more, or are there certain topics that, this review course has revealed to me that I should really focus in on and spend some more time and maybe extend, when I take the exam. But mind you, you don't want to extend too long. You really don't want to take gaps. You don't want to fail. Once you go into any program, any medical school, any profession, as I mentioned earlier, you want to give back to yourself. You want to eliminate distractions. You want to know what you don't know, and that's my best recommendation because the things you don't know will make you a better person. And if you learn one thing new every day, you're smarter than you were the day before.
For sure. I love that. And that's something else that also just follows you through life, right? I love it. Good, just good advice for sure. Another admissions question that came through, I'll just address this one. The prerequisites, they are required. That's a great question. I would be more than happy to look at your transcript. If you want to email them over to me, I can look at them and give you some feedback. And if you're missing one of the prerequisites, I can refer you to an online self-paced program that's really good, labs included. So yeah, just send me an email if you'd like, and I can help you offline with that one for sure. But yeah, Dr. Khobeir, here's a good question for you. We have someone on who's interested in emergency medicine. So this is all you. I love it. Do you have any advice for someone who would like to be, matched into emergency medicine? And how has UMHS provided you support and guidance into residency?
All right. So, love the question. I appreciate it. So, just a little background. I always wanted to do emergency medicine. So that helps. And the reason I say that is when you start your second half of your clinical life in medical school, you don't always have to know what you're doing, like what you want to go into. That's what the third year rotations are, but it helps. And I say that because what I'm going to tell you to do is way more than what most people do. So emergency medicine it was when I first applied, incredibly hard to get into. Then it dropped right after COVID because of burnout rates. And then it's way back up. I think there were 101 unfilled spots in the region. And there's 4 regions as compared to over 500 when COVID first started. So it is becoming incredibly hard to find an emergency medicine residency in general. So with that said, what did I do to get to that point? I will share that I matched into my #1 program. I had 15 ranked. I had 15 interviews, 10 I ranked, 5 I said, I'm not doing this. And I had people where emergency medicine directors called me and said, hey, this is your interview. You came and shadowed us, and they're called shadow shifts, where you just go, you ask for permission, obviously. You go, you spend a day with a resident and an attending, and that's it. And he was basically like, hey, if you want this spot, it's yours. And it's very fulfilling to know that. But the way you get to that point is your personality, the people that you know, the connections you're going to make. You're going to create a reputation wherever you are. So that is ultimately what makes you who you are. It's not your exam, it's not your GPA, it's not what you did or didn't do. It's who you are as a person, especially in emergency medicine. It's about camaraderie. How are you going to connect with those around you? Are you going to be argumentative? Are you going to ask a lot of smart questions? It's not really about being the smartest. It's about enjoying your time there. So I would spend time outside of my rotations to go down to the emergency room in McLaren to say, hey, do you mind if I'm here? And they're like, oh, no, not at all. We have other students. I'm like, this isn't my rotation. So, hey, you're good. During that time, UMHS also helped me by getting me more exposure. So what do I mean by that? McLaren has many systems. So UMHS was able to, because they have certain rules that you can't do more than so many rotations as an elective in emergency medicine. But urgent care is a whole nother area that is not emergency medicine. So I was able to do within our own McLaren system multiple rotations so that I can get exposure, because it's all about who knows you. How are you going to fit? Is somebody going to ask you to do something, or are you already going to be doing it?
Guys, I need you guys to leave now, okay? I'll put those back.
So ultimately what happens is, if you show that you're hardworking, you show that you're able to do what's asked of you, you and UMHS obviously is helping you through all this, you're going to be able to match emergency medicine. It's definitely a field of who you know, not how smart you are, which obviously can't be said for a lot of other areas in medicine. Unfortunately, but emergency medicine is a great balance. So.
That's so insightful, Dr. Khobeir. Thank you for sharing that. And listen, I'm curious to pick your brain too a little bit further. Do you feel that it was more difficult for you to match as a Caribbean grad?
So that was my worry initially going to the Caribbean, because you need to get into residency. And I will say, not at all. I was most worried, as Dr. Rustom had said before, in terms of faculty, where you already knew where you stood. So when I went into the match, I already knew where I stood, which was absolutely amazing. It was a great feeling knowing that I wasn't going into a match trying to, oh man, just impress people and do this. They already knew who I was. I had already done this interview 2 years, and I am who I am, and I didn't have to fake it till I make it type thing. It didn't matter. This is who I was. This is what they liked. And I could choose to look at a residency program with different eyes. Oh, I don't like your program. I don't have to go there. Wow, you guys are really depressed. I don't want to be depressed. And when that happens, ultimately, it's the best feeling, because it's really pounded into your head as a Caribbean student that you take what you have, what's in front of you, and you say thank you. It doesn't matter what it is, but that's the furthest from the truth. And I'm so grateful to UMHS for giving that opportunity to say, no, you can make a choice. There's many decisions to be made. And so when we went into interview processes, it was great.
For sure. I love that. I love that. And I think honestly, Dr. Khobeir, a little bit of that really does parallel with just getting into medical school and applying to medical school. I find every week when I'm working, I'm having the same conversation over and over. Students, are worried if they go to a Caribbean school, are they going to match? And I find, again, it's the same conversation. I'm a broken record, but that's okay. I'm happy to be. Wait a second. It's a lot less about where you went to medical school and a whole lot more about your performance and, your GPA from basic sciences, or that really strong transcript that you can present, and your step 2 CK score, and the networking that you can do during clinical rotations, right? And to your point, these shadow shifts, these auditions, like you treat these electives like, they're your everything, because these are the places that you want to apply to and you want to be ranked and that you're going to rank. So it's a whole lot more of all of that and a whole lot less about just, oh, I went to a US school, so I'm going to get into this residency, when quite frankly, it's your performance. That's everything, your performance, for sure. Yeah. So, Dr. Thibault, I want to throw this over to you. Why UMHS? Why should students consider UMHS?
So I can tell you, when I was applying to schools, I had many connections at AUC, American University of the Caribbean, on St. Martin. Well, I got in, but I also got in for UMHS, and I was going to do the ARP program. And I kind of went back and forth. Do I do this ARP program and take the path less taken, so to speak? Or do I just straight up go to AUC? Honestly, maybe this is probably just a part of my personality, but I wanted to do my own thing, right? And when I met with the folks from UMHS and I went to the office here in Michigan, met face to face, when you just know that gut instinct, that was the right choice. Point blank. So there's that part. Now, if you want the scientist brain, data-driven decision, it made total sense. Number one, the tuition cost was very reasonable, right? Medical school is extremely expensive everywhere. But the reality was, when I looked at the tuition costs and what it would mean, what was included, and that's, I'm talking like the resources that Dr. Khobeir was referencing earlier. It just made sense. That alone was reason enough. But then you go and you meet the professors who are there. You meet who's teaching these courses, and they're just incredible. They were wonderful human beings who not only are experts in their fields, but they genuinely like to teach. Like, they didn't have to be doing this, right? And so I really enjoyed that aspect of getting to know them, and that made a big difference. And that's similar to my undergrad experience as well. I chose my undergrad location, and it was totally different from where I initially said I was going to go. I was going to be a Spartan.
Oh,
And I just said, you know what? That's not the right choice. Albion was small. I gravitated towards the science department. I met with the professors there, and I had that same experience at UMHS. People who were invested. There's something to be said about that. I don't care where you go, but your professors, the physicians who are teaching you, need to be invested in you. And that was what happened. So tuition costs, the professors and physicians, one of my favorite physician professors was Dr. D. And he passed away very suddenly a few years ago. And to this day, I'm still like, I'm mourn, his passing. But Dr. Nagapa, I still talk to him, and my former scribe was supposed to be his TA. One of those connections. And then Dr. Mungley, who is Dr. Mungley of YouTube biochem fame. Okay, just Google him. He's wonderful. But I was his student, and he called me on my wedding day to wish me well. Like, those are things that came afterwards, but it was the proof in the pudding. Like, I could tell when I met them. And even to this day, I'm an attending, I'm a partner in my practice. These are people that still root for me. They still send me messages and say, congrats, we're happy for you. It's so good, though that means something. I didn't find that at other schools I talked to. I didn't see that at St. George's when I looked. I didn't see it at Ross. These are all viable options. I got no problem with it, but it wasn't what I looked for.
for sure. UMHS is a very, very special place. No
It
doubt,
is.
for sure.
We're planning to take our kids back sometime this year. We're trying to figure out when.
Nice.
So, yeah.
Oh, that'll be fantastic. And it'll be so different, Dr. Thibault, too. You like being there on vacation. It'll be, yeah.
I can actually go do the things my husband was getting to do.
Right. While you were, studying, right? And in class. I love that. Very good. Thank you. Dr. Rustom, I want to throw this one over to you. What do you feel that we can offer, UMHS can offer to students who want to return to the Midwest?
Oh, I think the Midwest is a hotspot for international graduates, especially in the Detroit area. I was actually just looking at the match results that y'all had in 2025, and I saw a lot of things, and I urge a lot of the viewers today to go online and kind of see what the match results were, and that can kind of reassure you, and you'll see that a lot of specialties, various specialties are attainable. And I think you do have to work hard to stand out amongst your peers on your rotations, and as much as you can, you want to try to work or rotate at least electives at areas or hospitals that you could see yourself as a resident and living for 3 to 5 years, depending on what you decide to do. And the Midwest is a hot spot. I know we have a lot of associations. We match many medical students into anesthesia, internal medicine, a couple into physical medicine and rehabilitation, emergency medicine, psychiatry, OBGYN, many family med. So there's a lot of opportunity here in the Midwest, and many people from Canada also apply, and I noticed there was a question regarding if there is a non-US pathway that medical students could go into, and I think my friends, at least from Canada and other countries, were able to go back and practice in their former countries, but those countries require you to practice for an additional 1 or 2 years, or do another fellowship, or have a certain period of time as a resident before they allow you to sit for their boards. So you'll have to take those boards in your respective country to be qualified as a physician. So you have to look at those requirements. But the Midwest is home to really UMHS. I think that's where the family kind of grew up, if I'm not mistaken. I know home base or the headquarters was here, at least from an admissions standpoint. But the main office is in New York City. And so I would highly suggest you to apply if you are from the Midwest and you're interested in sticking around. I think it sounds like everybody here today that's a panelist is from the Midwest and just Michigan. So, I mean, that goes to show you quite a bit there.
For sure. We've got some great hospitals that we're affiliated with here, of course, absolutely, for clinical rotations. So yeah, that's definitely a piece of that as well. But thank you, Dr. Rustom. Many good points there. Yeah, we're kind of wrapping up, y'all. So, Dr. Khobeir, do you have anything maybe that you would like to say, just final remarks?
So there's a question that came about, and then there was a comment. There's someone from our attendees that I actually did a rotation. I can only talk for emergency medicine. And then the other question is that I answered, what are things we should avoid to increase our chances of getting MASH as IMGs? So this is what I would say in general for everybody who's attending. Yes, whatever people have said in the past were true, and they may be true in a lot of locations in terms of, being an IMG and you're looked down upon. But I would treat yourself like a U.S. medical student, okay?
Mm-hmm.
I have found that UMHS students are far more prepared than U.S. medical students. I'm going to start there. Okay. Caribbean students in general, I've had many who are come outside of those rotations. If you want something, you're going to learn that thing when you're there, and it's going to show what you know. The other thing is that Gabriella, who is with me on rotation, she was proactive. So I remember her. It's easy to be that person that stands out, because when I might say, hey, come do an ultrasound, they're going to say yes, and they're excited, and they do it, and they learn, and they want to learn. I want to teach. So I want to make sure that you're going to get everything you could ever want. And by the time you start, you have things under your belt. The other things is, and just that it goes along with it, if nobody knows you, you're probably not going to match you're not going to match. It has nothing to do with you're an IMG. I promise. The hospital I'm with has a contract with both Michigan State University students, and they have it with UMHS. Everybody wants emergency medicine. So do we just take American students? Which hasn't happened. And the reason is because we remember you. When you're on rotation with us, we're going to know who you are because you want to do things. People who are more proactive. I can tell you, multiple students from many other schools, not the Caribbean, who will just sit there. Patients will come in, we'll ask them once, and then they just sit there. You ask a Caribbean, you ask a UMHS student, they'll tell you, hey, I'm going to see this patient. That's exactly what we want. That's the whole point. This is going to be your career. take interest in the things you're going to do. And I think that's the biggest piece of advice is don't shy away from it. Go there. I understand that this isn't, hey, you might not want emergency medicine, but you know what? Directors talk to each other. It's a small, every hospital system is small. If they see that you have to do this rotation in emergency medicine and you're happy doing it, even though you don't want emergency medicine, you want, let's say, internal medicine. I promise you, directors are talking to each other. Please everybody knows each other. The world of medicine in general is small, okay? Especially within hospital systems. With that said, don't listen to the person next to you who says, hey, I'm doing this. This is how I'm studying. This is how I'm going to get a residency. Don't listen to them. Do what's good for you. Okay. If you start listening to every other person, trust me, nobody has the best person's interest other than yourself. Okay. That would be my biggest takeaway piece of advice. Listen to yourself. This is going to be a long journey. Dr. Rustom has said a million times, this is about stamina. This isn't about how fast can you go from 0 to 60. Because if you do, I promise you're going to get burnt out. And it is very, very important.
Definitely. Oh my goodness. So many good points, Dr. Khobeir. Thank you. And thank you for hitting those questions. I apologize. I didn't see those there. So thank you so much. Teamwork. I love it. Dr.
I'd like to interrupt here, Corie.
Sure. Go ahead.
I'd like to handle just a couple of these questions. One is an interest in physical medicine and rehab. There's a medical student, 4th year, who's interested. And, just as Dr. Khobeir suggested, you really should try to get an elective rotation, see the program, get a letter of recommendation from one of the attendings, possibly see if you can publish a case report at a local conference, and maybe even go to the PM&R conference. There are many medical student events available at these conferences, and allow you to engage with different residents and fellows, and get to know the residents when you're on the rotations, because they play a large role in where you're going to be accepted. And as a part of the faculty on the pain medicine fellowship and rehab residency, I can only tell you that you'd like to see the interested parties and the ones are going to carry more weight. So my recommendation is to try to get some research in at this stage with, coming out the late summer for applications. You may have time for 1 or 2 poster publications, maybe a letter of recommendation from the program, particularly that you want to go to. And always have a backup plan too. Don't throw all your eggs in one basket is my recommendation. You just have to be, you have to be honest with yourself and your application. And I know it's very challenging now with the lack of the numerical score provided on the boards. And you just have to be ready for any possible scenario, and to increase your risk or reduce your risk and increase your chances of landing a spot, you're going to want to do an elective somewhere. And the other one about people who have houses with mortgages, car payments, and jobs, any other program or alternative options. That sounds like there's a lot of liabilities involved. And so, it's going to be a challenge. You may not be able to work, if I understand the question correctly. But you can get a loan, to pay for your medical school. And maybe you can rent your house and sell your car. You probably won't need it anymore. When you get down to the island, there's transportation, you can rent there. And if I was in that situation, I would probably sell my car and my house, or rent it out. Probably rent out the house.
For sure. Thank you, Dr. Rustom. Thank you guys for looking at those questions. Yes, thank you. Dr. Thibault, anything like final remarks, closing that you would like to share or say?
I would say, even if this is plan B, plan C, doesn't matter. You get what you put in. And I'm a big believer in, if you do the work, you stay steady, your goal should be set in stone. Your goal is, you want to be a doctor, you want to be a board certified physician practicing on your own. That stays steady, but your path can change and how you get there. As long as you're putting in the work, you are a kind human being. You treat people with respect. Trust me, like Dr. Khobeir was saying, you will get there. It will be fine. Okay? These are hard years to go through, but I can tell you, you know, I wouldn't change it for anything. I'll tell you, the last 2 weeks have been very trying. I've had some very hard diagnoses that I've had to give. I'm a primary care doctor. I see everything cradle to grave, and I love it. I wouldn't trade it. Even when I have to give bad news multiple times in the last week and a half, I wouldn't trade it for the world. I would do everything I did again to get to this point. It also gives you a lot of autonomy in your life. So if this is your plan, know that for a short period of time, you will not have control over your schedule. You will not always get to go to the birthdays, the weddings, funerals, things that are important to you or your family members. In the end, you will. You will get the autonomy. Every Monday and Wednesday, I'm at the gym at 6 a.m. And then I spend the rest of the day hanging out with my kids.
That's
And the rest of the time I am in the clinic and I am doing my stuff, but
yeah.
I pick and choose. Your priorities, you just stay steady. You'll be good.
For sure. I love that. Well, listen, I mean, the three of you, you all are incredible and amazing. And just thank you for joining us tonight and sharing all of your insights and experiences, all the raw, real hard stuff. Your honesty is greatly appreciated. But thank you guys so much. Like, y'all are the real superstars, and it's very inspirational for me, and I know it's inspirational for the students who are on. So thank you guys so much. And listen, everyone, my information will be shared, so please feel free to reach out if I can assist with anything that you all need regarding your journeys to MD. I'm here for you. And thank you so much, everyone, for joining us this evening. Thank y'all.
Thank you for having us.
Thank you.
Have a good one, guys. You can reach out to me anytime. Corie has my info.
Thank you. Thank you, Dr. Thibault. Awesome. All right, guys. Good night. Thank you.
Have a good one.
Bye.